Welcome back to Fox 51 Today. There's a new heart valve program at the Lewis and Peaches Owen Heart Hospital. Nurse Navigator Jessica Wilson is here to tell us more about this. Good morning.
Good morning.
So tell us about this heart valve clinic and this program that East Texans can, go and check out.
Well, the heart valve clinic is designed to help patients early diagnose heart valve disease and to find the best treatment options available to them. The real benefit of the clinic is the multidisciplinary evaluation. When a patient comes into the clinic, they are seen by a cardiologist and by a cardiothoracic surgeon. During the appointment, both of them collaborate with the patient to form a comprehensive plan of care and to determine the best treatment option available for each patient. Typically, these appointments happen over a 2 to 3 week time span, but we ensure that they happen the same day for the patient.
Oh, that's great.
Yeah, so Jessica, what kind of problems do people have with valves that aren't working properly?
There's two different kinds of problems. Either the valve doesn't open all of the way, which is stenosis, or it doesn't close tightly and form a tight seal, which is regurgitation. Over time, if that problem is not fixed, it causes the heart muscle to work harder and pump harder, and over time it enlarges the muscle and it actually weakens the heart, and the patient can develop congestive heart failure.
Oh, wow. Well, now if we have these problems, what are some of the treatment options that we have?
Well, instead of the traditional operation, which requires breaking the breastbone, Dr. Dulab is able to go in through the rib space through a small incision to either replace the aortic or the mitral valve. This is done without breaking any bone, so recovery time is much less. There's fewer complications and there's less pain. Typical recovery time from the traditional operation is about 6 to 8 weeks, and with a minimally invasive technique, recovery time is about 10 days, so that's pretty significant.
I would say so.
So when you're evaluated in there, I guess I know a thing of the past, I remember somebody they had a heart Doppler. I mean, there's all kind of instrumentation to use that. What do they primarily evaluate the patient with initially?
Well, the initial evaluation is an echocardiogram. It's just basically like a sonogram that's done over the front of the chest, and it kind of looks at the heart. It tells you how well your heart's functioning, and it takes a look at the valves to see if they're opening all the way and if they're closing tightly. That's the initial exam for patients.
Okay, and as we were saying earlier, you are a nurse navigator. For some people out there that aren't familiar exactly what that is and why that's important, will you explain that to us?
Well, as a nurse navigator, I ensure that each patient receives appropriate follow-up care and is educated along the way regarding their disease process and treatment options available. I'm kind of the central point of communication for the patient and the providers. If a patient has a question or concern, they can call my direct line and I can answer any questions or concerns that they may have. I also manage a database that consists of all echocardiograms completed in the Trinity Mother Frances health system. If a patient has moderate to severe heart valve disease, I go through the patient's chart and screen them to see if they're an appropriate clinic. It kind of catches those patients that falls between the cracks so that no one is missed.
And what are your, how do your hours of operation work? Is it pretty much at 8 to 5? You go a little later than that?
It's typically 8 to 5, but if we have to go a little later, like if clinic's running a little late, we obviously do.
Now, what are some of the qualifications for you to be treated at this clinic?
Any patient who has ever been diagnosed with a heart murmur is a candidate, or if you have known heart valve disease with symptoms. Symptoms of heart valve disease are shortness of breath with activity, fatigue, have you noticed yourself taking more naps throughout the day, chest pain or chest tightness, heart palpitations, dizzy spells or fainting, or swelling in your ankles or your feet.
Well, thank you so much for stopping by this morning and telling us all about this.
Thank you guys for having me.